Hi, and welcome to another Why the Long Face shortcut.
So this tackles the controversial subject of ECT, electroconvulsive therapy. It sounds quite brutal, but actually the doctor does a great job, I think, here of explaining why it can be beneficial.
Right, here we are again, and we're going to talk about ECT, or as you call it, zapping people.
Zapping people in the bonds to make them feel better, you barbarian.
Yeah.
Because you're pro it.
Am I?
Yeah.
Am I?
Yeah, it's a simple fix. Bit depressed.
I'm on the fence.
Pills, they won't cheer up. Electrodes on the temples. 20,000 volts, did that work? Cheer up. 40,000 volts.
I think you're guilty of black and white thinking there, Ol, that you can either be pro or against ECT. I would say depends on the individual case.
Oh, that's so nice.
Doesn't it? What about the patient who's had it before, miraculously got better quickly, and unfortunately not so well now, and wants it again? Yeah.
So basically what I'm expressing as a point of view that is out there, I don't have, is that putting electricity through the brain, it sounds horrible. To the man in the street, it sounds horrific. We better probably say, what is it?
Electroconvulsive therapy is the induction of a generalized seizure, like an epileptic seizure, but a modified seizure, modified by medication, which stops you moving about as much. But it's the seizure that has the therapeutic value. And it's the electronic charge which triggers that. It has been shown to have some chemical changes in the brain, which thought to be welcome changes that correlate with getting better from depression. It doesn't work for everyone. That's true to say of all treatments. I tell you what, we'll talk about positives and then the negatives. So positives are, it works quicker than antidepressants. It's more effective than antidepressants.
More effective in terms of it gets a better result, or more likely to give you a better result?
You've got a better chance of getting better with ECT than a standard trial of an antidepressant.
Wow.
It's probably the most effective treatment we've got for depression. Now, the downsides. You have to have an anaesthetic, right?
That's a risk.
But it's a very short-acting anaesthetic. I've been in an ECT suite, and the anaesthetist is breathing down your neck. You do a thing called dose titration, but if you don't get that right after a couple of goes, the anaesthetist is calling time on you and saying, no, we'll have to rebook.
When you say don't get this right, well, what do you mean? You're experimenting?
Everyone has a different seizure threshold.
Oh, right.
There are certain norms that you can calculate from gender and age, okay? And based on those, from experience, you'll go, right, we'll start at this level of charge. And if that doesn't induce a seizure, then you'll step up a bit to another slightly higher charge, and so on, in a stepped way. So that's one way, in fact, in which ECT is improved. The main side effect that is of concern is the cognitive ones. About 70% of people who have ECT are going to have some form of memory loss within 3 days of the course of treatment. Evidence shows that in nearly everyone, those memory problems are resolved within 6 months of the end of the course. In my experience, people rarely reported memory loss a few weeks afterwards. But there is undoubtedly an issue of losing some of your long-term memories, which may not return after 6 months in some individuals.
That's a minority of cases, I take it.
Right, but that is something you always have got to be clear about when someone is deciding whether they want the treatment or not.
So a couple of questions there. When you say a treatment, how many zappings is that?
So you have 2 or 3 a week, and you may have between 8 and 12, and sometimes more treatments.
And then the amount of charge you said you give them, is that going to be the same every time?
Sometimes you'll need to increase it.
And do people feel better after the first couple of zappings, or does it normally take? Because you're saying it was quicker than antidepressants.
If you're going to respond, you'll generally have responded after a couple of weeks.
Okay.
You won't be fully better, but you'll have noticed some improvements. And the improvements tend to be in things like sleep and appetite first, before feelings. So the mood might lift later.
Got it. That sort of makes sense, doesn't it, really? Because once your appetite's better and your food, you'll sort of be better in yourself, aren't you? You're getting more rest. You're getting more sustenance.
Yeah, if you're sleeping better, that is going to improve your mood. That is true, actually.
Yeah, I would have thought so. That's really interesting.
Just wanted to make this point about the amount of charge you use and the electrical. So there have been big developments in ECT machines since One Flew Over the Cuckoo's Nest. We now have we use a different form of electrical pulse. It used to be sine wave pulse, which caused more confusion and more memory loss. Now we use a different waveform.
Really?
With square pulse.
Amazing.
And also this dose titration thing. So the higher the dose of electrical charge you give, the more cognitive side effects you're going to get. I mean, that stands to reason, I guess. And so now we have this dose titration system that is also reducing the likelihood of memory problems. Also, rather than putting it through both sides of the brain, you're putting it through one side of the brain, and it'd be the non-dominant hemisphere. So there's all different ways in which you can reduce the likelihood of getting memory effects.
So I think what we've got to remember in all this, however brutal it sounds, you just have to say electricity and brain, and you start to think Frankenstein and stuff like that. Actually, a lot of surgery is pretty brutal when you think about it. Open heart surgery is incredibly brutal, and I think you've got to put yourself in the position, and this is from a layman's perspective, of someone who has been depressed chronically, nothing's worked for them, their life is hell, and this is an opportunity for them to get out of that hell, and they're entering it willingly. And it's kind of, who are we to make judgments?
Well, and we don't, because ultimately it's the client who decides, unless it's an emergency. So the two main scenarios where ECT is now prescribed in psychiatry is in the emergency situation and the situation you've just described. So it's not a first-line treatment. You come with your first depressive illness, no one's going to say, "Oh, let's give you ECT."
Just walk into
the
chamber,
as you'd say.
Yeah, just have two wires hanging out the door frame. Just walk out the surgery. So, question on the emergency. When you say emergency, it sounds to me like someone in such deep crisis that the likelihood of them harming themselves is very high.
Yeah.
Is that what you're talking about?
Emergency ECT, yeah, and even in that case, you can't just decide on your own as treating psychiatrist doctor. You need an independent doctor to come along from the Mental Health Act Commission as well to sign it off, and you'd ideally have loved ones and relatives backing up your decision there, because. But we're talking about the rare situation at the very sharp end of depression, where someone is hospitalised, they're very, very, very agitated, extremely suicidal, and or not eating and drinking.
Do you know what? It's actually almost cruel to deny them the treatment in that situation.
Well, in that situation,
because it's the only way out of what must be.
As I said to you, it's quicker and often more effective than waiting for antidepressants to work, because as we just said, it can take 4 to 6 to 8 weeks for a medication to work. So in that situation, that's not going to cut it. Hey, thanks for joining us on Why the Long Face. As ever, we're here to inform, hopefully, and entertain, but we're not here to give you medical advice. There is, however, information on our website, whytlf.com, that's whytlf.com, about where to get help. See you next time.